Nasal polypectomy. First of all, what are nasal polyps? Nasal polyps are formed when parts of the lining of the nose and sinuses swell. They can look like a bunch of grapes. Most nasal polyps are caused by an inflammation and irritation of the lining of the nose and sinuses. Nasal polyps can block the narrow channels through which the sinuses drain into the nose, leading to an inflammation of the sinuses, which is also called sinusitis. When large, nasal polyps can block these nasal passages, which makes breathing through the nose more difficult and can also affect the sense of smell. Here are other examples of nasal polyps. What are the symptoms that you may experience? You may experience a blocked nose, a decreased sense of smell, and also symptoms similar to sinusitis. As you can see, polyps are able to block the nasal passageway and affect drainage of the sinuses. What are the treatment options? Steroid drops or sprays for the nose are tried first. They can shrink the polyps and improve the symptoms, so you don't need an operation. If this doesn't help, then you may need an operation called a nasal polypectomy. The polyps are removed through the nose using a fine telescope. What will happen before your operation? You will need to come to a pre-operative assessment clinic which assesses your fitness for the surgery. Here we do some swabs checking for infection, request any necessary tests such as an X-ray, ECG or blood tests. We will also meet with the ENT surgeon to discuss the operation in detail, including the risks and benefits, and then he will take your consent for the surgery. Your surgeon may also arrange a CT scan of your sinuses to use as a map for the surgery. On the day of your operation, you will come to the ward or wait in the day room, and the nurse will do some basic identity checks. You will then be seen by the anaesthetist and your ENT consultant before you go for the surgery. Regarding the anesthetic, your surgery will usually be carried out under general anesthesia, so you will be asleep during the operation. You will be asked to stop eating and drinking from midnight on the day of your operation. After the operation, you can usually go home as the operation is done as a day case. But there are some patients that may need to stay overnight on the ward. Usually we use a pack in the nose which dissolves after a few days. Using a salt water spray can make the pack dissolve quicker. You may be given other medication to take. Make sure you follow the instructions given to you about the medication because it will help reduce your symptoms. Your surgeon may arrange to see you in clinic 6 to 12 weeks following your operation. Patients are also advised to take 2 weeks of rest following their operation. Are there any risks with the surgery? There are risks as with any surgery, and we need to tell you about the common and rare but serious complications of this particular procedure. Common complications include bleeding, which is usually controlled during surgery or with nasal packs. Nasal polyps also have a tendency to come back, especially if you don't continue with your steroid sprays after surgery. The nose may also feel blocked after surgery. This is due to swelling in the lining of the nose. It could also be due to dissolvable packs we leave up in the nose to help healing. Rare complications of this surgery include fluid leak from the brain. The nose and the sinuses are very close to the bone of the base of the brain. Rarely, a leak of the fluid from the spaces around the brain may occur after removal of a polyp. In the unlikely event of this happening, you will need to stay in hospital till the leak stops. A second operation to stop the leak may also be needed. The nose and sinuses are also very close to the eye socket. Very rarely, bleeding into the eye socket may occur. This may affect vision, but the chances of this happening are very low. If you have other questions, please visit www.entplymouth.com or call the following number, or you can also reach us by email. There are also websites that you can go to for further information. If you need to raise a concern, then please contact PALS. Thank you.